Okay, welcome to our May 15th special Board of County Commission meeting. Would everybody stand for a moment of silence and remain standing for the pledge. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we have an additional item to our agenda, Department 2, Water Savings Clause application to the Lake Okeechobee System Operating Manual. And with that, can we have a motion to approve the agenda?
Second.
Okay, we have a motion by Commissioner Smith, seconded by Commissioner Campy. All in favor?
Aye.
All opposed? Motion carries unanimously. Okay, we're going to, as usual during our Friday meetings, we're going to postpone our public comments till after our presentations for our coronavirus updates. And with that, we're going to start with Mr. Rob Lord, Cleveland Clinic.
Good morning. Mr. Chairman, Commissioners, thank you again for the opportunity to be here. I am concerned about some things we've seen in the last week. I did a little math from May 6th to May 12th. The percentage of patients who tested positive in Martin County is significantly higher than it is for both St. Lucie County and in the River counties. My calculations are that Martin County's percentage was about 11.5% compared to 3.3% in St. Lucie County and 0.6% in Indian River County. I'm sure much of that's attributable to what's going on in Indiantown. We continue to identify COVID-positive patients coming through our drive-through locations. We've also identified a few additional patients. As I indicated last week, we're testing every patient before they come in for a procedure. And we've identified a few other patients who were asymptomatic who had no idea that they might be positive. That is a very small percentage, however. So we must continue to be vigilant, exercise good hand hygiene. I think we did a really good job of that at first, but I think we're getting a little bit lazy. Social distancing, critically important. Mask wearing, that seems to have turned in our community. I've had several discussions where the person I was in the discussion with wanted to make it a matter of their rights. I would prefer to view this as a question of manners. It's disrespectful of others. And you put other people unnecessarily at risk. Wearing a mask is more to protect others than it is to protect ourselves. Those are all keys to avoiding a surge of new patients. But as I travel to and from our hospitals, and I make observations, or I drive through downtown Stewart and other areas, I see behavior that's not consistent with these guidelines. We continue to work very closely with the health department as well as our first responders. Carol Ann and I, yesterday on the phone, we've been in daily contact. We're joking that we have each other on speed dial. Our teams are in constant contact. Our first responders have been incredible. Very supportive of the pop-up testing that is being done by the health department. And I'm very anxious to see the results. We had, I think, a little over 400 people tested in East Stewart day before yesterday. So as we get those results, we'll know a lot more next week. And I'm certain that Ms. Vitani will be discussing that shortly. I mentioned last week we have resumed non-essential surgeries. We are ramping up those surgeries, expanding the criteria. Last week I said we were limiting it to short stays. We'll continue to expand that. We continue to test every patient for COVID. Prior to surgery, every patient that's admitted, making every effort to ensure the safety of our patients and caregivers. We've also amended our policy on visitation. I want the community to know that. For patients undergoing surgery that require overnight stays, they will be allowed a single in-person, one person to come and visit them both on the day of the surgery and the day after surgery. All visitors, though, must agree, if they're going to be in our hospital, to strictly comply with our rules regarding masks, social distancing, hand washing, and such. And if they fail to do that, they'll be asked to leave. On our safety efforts, as we continue to ramp up our services, our focus remains on the safety of both patients and caregivers. And I previously have discussed at some length what we have done. It's imperative that people in our community feel safe to receive what they need. I think I mentioned last week that volumes in emergency rooms across the country are down substantially, and people are apparently afraid to come to the emergency room. I saw a report this week, estimated 38% drop in heart attacks presenting to hospitals. I don't believe those heart attacks aren't happening. For many, the results are tragic. There are things, stroke, heart attack, blood clots, where you can wake up and feel fine in the morning and be dead that afternoon. And people need to come to the hospital. Cancers that could be detected early and be treatable are probably being missed at this point. So I find it interesting. This past Monday, the CDC announced some data showing that in New York City, the number of deaths from causes other than COVID are 5,000 over what they would expect to see over the last couple of months during the course of this pandemic. And that could be attributed to a number of causes. I don't mean to suggest to you that the only thing would be this, but I think it's a pretty strong indication that people in New York City are avoiding hospitals and dying as a result. We want our community to know that we have gone to and continue to go to exceptional lengths. And please do not avoid dialing 911 if you need to, and coming to the hospital if you need to, and we will take care of you and keep you healthy. Today marks 2 months since we started drive-through testing, and during that time we've tested more than 2,500 people at both North Hospital and up at Tradition Hospital. Again, anyone over the age of 16 with a fever and respiratory symptoms, also includes anyone with a fever and gastrointestinal illness. If you have any of those symptoms, dial 772-419-3360. But I want to distinguish our testing from the pop-up testing that's going on. I'll let Carol Ann address that. Their criteria are broader than ours, and if someone wants to be tested, there's a way now for anybody to get a test, I think. We continue to see a great turnaround time. We have over 99% of our test results in, so we're doing very well with that. That was, as we all know, a huge problem early on. If I might just take a couple of minutes, because another conversation that's been occurring in our community, and I know it's a hot topic across the country, is this concept of herd immunity, and that's going to be the answer. Herd immunity is an epidemiological concept that deals with a certain percentage of a population has to have developed immunity to something to prevent the spread of the illness. It varies. There's only 2 ways you get immunity, basically. You either get the condition and you develop natural antibodies, or we develop a vaccine. And there's not really any other choices. Herd immunity is calculated based on how transmissible a disease is. The more transmissible the disease, the higher the percentage of population that has to get the illness. And I've seen estimates for COVID around 70%. It could be higher, it could be lower. That's an educated guess at this stage for any scientist that's trying to come up with it. But let's say 70% of the population seems to be a number. Now, it could be worse. Measles is 95%. We have to have 95% of our population to have herd immunity for measles, because it's more transmissible. But COVID is highly transmissible. We're so far away from that. First, I would hazard a guess maybe 1% to 2% of our population right now. And that's a long way away from 70%. And we don't know if natural immunity is effective, And we then obviously don't know if it is effective. How long is it effective? Does it give you immunity for 6 months or a year or 2 years? And I'll tell you, if the answer is yes, for 6 months or a year or 2 years, it's irrelevant in this, because unless we have an incredible, massive outbreak and overwhelm the healthcare system, it'll take 2 years plus to get to that 70% number, and you just never get there. We need to focus on a vaccine, and in the meantime, we need to be focused on defenses such as social distancing, mask wearing, good hand hygiene, again, contact tracing and early identification so we can isolate those people. And I know that we're working hard on that. And I've already talked about masks. But I would just encourage everybody to do that. In closing, this is National Hospital Week. And we're very proud of that. We celebrate that every year. But it's never been more worthy of celebration than it is right now. I'm incredibly proud of the 4,600 people that work in our organization. And if any of them are watching this, I just want them to know how proud I am to work with them, and how proud I know the entire community is of them. I'll be happy to answer any questions.
Any questions? Go ahead, Mr. Camping.
Mr. Lord, thank you very much. I appreciate all you're doing and your team, as you said. Last week, right as you were leaving, you made mention that for the first time in a long time, you didn't have anyone in the hospital admitted to the hospital that were COVID-19 patients. How many people are in the hospital currently now?
To clarify my remarks from last week, we did not have anybody in the ICU. We did have patients. We've never been without patients.
COVID patients.
COVID patients. But we did not have anybody in the ICU. That is no longer true. We do have ICU patients now. The data that I had from yesterday was we had 11 here.
Totally in the hospital? Or?
Yes.
Okay, thank you. And is that just our hospitals here in Martin County, or is
Yeah,
that tradition as well?
Those are principally at North, but that would include North and Tradition. There are no COVID patients in South Hospital right now. We're trying to cohort, because the numbers are where they are, we can cohort those patients in a unit at North Hospital and isolate them from the rest of the hospital population. So we're principally using North Hospital in Martin County.
In Martin County, and then I know that up in Tradition, there's a couple there as well?
Yes, yeah, we do have some patients up there. We haven't seen the, and whether this is just a blip on the radar or not, or what's happening in Indiantown, we'll have to figure that out. In St. Lucie County, and out at Tradition, it seems that we're holding steady or maybe improving a little bit, and here we're coming up just a little bit.
Thank you. But when you speak of the 11, that's between the two?
Yes.
Thank you.
And that was yesterday. I'll get a report out at 11 a.m. this morning.
Thank you, sir.
Any other questions? Thank you, sir.
Thank you.
Really appreciate it. Okay, next up we have Caroline Valente from the Health Department. Fatani, I'm sorry. There is no L in her name.
He's going back and forth, yes.
Well, good morning once again, Commissioners, and thank you for the opportunity to provide you with an update on our COVID-19 situation in our community. Once again, I just want to thank all of our wonderful, amazing, incredible partners that we continue to work with so closely. Cleveland Clinic, of course, our Sheriff's Department, our emergency operations, all of our nonprofit organizations, and Florida Community Health Centers, et cetera, et cetera. So the only way we can accomplish keeping this virus at bay is by working together, and that is what's happening, and it's amazing. So first, I just want to give you the latest numbers for today. In the state, we have 43,210 positive cases, and here in Martin County, we have 281 as of yesterday morning at 11, and it will go up today again, I'm sure, and due to the expanded testing. On Tuesday, we were at Big Mount Park in Indiantown, and we we collected approximately 213 samples, which was an excellent first approach there. And so we were glad to see that many had come out. And then, just as Rob mentioned, over here at the St. Joe's Church, we were able to test 420 residents, which was amazing. And I apologize to those that we had to turn away at that time, because we wanted to make sure that we had enough of our resources, and we will be providing additional testing in the East Stewart area, hopefully tomorrow, if the weather permits. The other was at Booker Park. We were there yesterday, and we collected 88 specimens, which was also great. And then we also did a special outreach, I believe I mentioned to you last week, at the St. Lucie Mobile Park, and we collected 73 specimens there. So those results are starting to come in. Also, important to note that Florida Community Health Center has also expanded their testing, and they've done several hundred as well. I know yesterday we're working with the food distribution initiative out there in Indiantown. So I'm anxious to hear how that went, and to see how many accepted the testing as well. So obviously the testing has been, the events have been extremely successful, and we're looking forward to continuing that the next week. Lab results are expected in any time now from 3 to 5 days. And the testing schedule for Martin County is posted on our website at www.martinhealth.com. We continue to do contact tracing. As Rob said, that is critical, that once we identify the positive case, we call them within 24 hours. We go through a rigorous assessment and questioning, and then we find out who they were in contact with, and then from there, my contact tracers start making those calls and follow up and provide the education that's necessary, what to look for if they start to become symptomatic, what to do if they need to be quarantined, etc. So we do that on a regular basis. Long-term care facilities, as you know, they are our vulnerable population, and so we are also going to be looking at a new initiative that many of you may heard yesterday, that the governor would like us to reach out to those facilities and also provide testing for them to their staff as well as to their clients. So we're in the process of going to that initiative as well. And of course, that will take, additional collaboration with some of our state incident management teams. Our communication, our testing events are being heavily promoted by the local news media. In addition, we've launched a COVID-19 testing and prevention messaging campaign, which includes 12 radio stations, some multiple languages, including Spanish and Concabol. One thing that we're very excited about is we are going to have a traveling billboard, and that will be a large box truck, will be wrapped with COVID-19 prevention messages, and will be traveling throughout the county. Audio truck, we've been working with our Martin County Sheriff's Department to actually provide information about the testing sites, especially throughout Indiantown. And we hope to do that possibly again on this side of town. And we're working that out. Also, once again, the face coverings. As Rob mentioned, we can't stress that enough, the importance of wearing a face covering in public. Obviously, especially when social distancing is more challenging, we want to enforce those prevention messages. Again, washing your hands, wiping off high-touch surfaces, wearing your face cloths, social distancing, staying home when you're sick. And also, if you are symptomatic or feeling sick, we still recommend that you speak with your physician. We are testing those that are asymptomatic as well as those that are symptomatic. And what we found through the drive-through that the majority were asymptomatic. And our epi team is going to follow that up on the back end as well. So that will be interesting. So, we appreciate that the residents are taking this seriously and that they're coming out to be tested. So that concludes my update. And once again, I want to thank you all so much for the opportunity. Any questions?
Go ahead. Stacy?
Who is eligible, or what are the guidelines for the pop-up testing? I know that you said they were a little different from the regular CDC guidelines.
Yes, and that is because we've expanded it to asymptomatic residents. So anyone, if you don't have symptoms and you'd like to be tested, you can be tested, whereas CDC still is following particular guidelines about age, high-risk population, and if you're symptomatic.
So you
So
don't
the
have to be
difference is it's
symptomatic.
free, you don't have to have symptoms, and well, for us, they're really age limit. We prefer 16 and older, but we have an amazing strike team that's come down, and if they feel that they can accommodate a child, they will. But we're going with the age of approximately 16.
Thank you.
Commissioner Hurd?
Yeah, my observation is that since we've entered into the phase one, that people have grown very comfortable. They're way too comfortable in public. I'm seeing much fewer face masks on people in public. Social distancing. I've seen party boats that are just full of people. It looks like January here or February here instead of what it looked like in March. And we have a chart of the COVID positive infections, a daily chart from 3/19 to today. And our statistics in May look as bad as they have ever. In fact, they look a lot like they looked the first week of April. So I'm really, really concerned about people not taking this seriously. They think that because some things are open that we're okay, we're over it, and we're far from over it. It's getting worse rather than better here. I think I'm really, really happy to hear about the pop-ups. I didn't know if people, because of fear, would not show up and get tested in the places where it was most important to get robust testing. So I'm really happy that 400 people showed up and 200 and something people showed up. So is it possible to expand pop-up testing, particularly in the areas that are most infected?
Yes. As long as we have the resources coming in, we can expand the testing, and my team and I have already been talking about that. Initially with this first response, we had such a robust response, especially over at St. Joe's, that we did stop it at a certain point, because we do this first time around, we want to make sure that everyone has an opportunity throughout the county to come for testing. And yes, that is in discussion.
And is that federal resources or state resources?
Those will be state resources.
Okay.
Yeah.
So are we fairly certain that we're going to be able to expand pop-ups?
I would say, well, I guess I don't want to speak yet, but can I get back to you on that one?
Yeah. Whatever
All right,
we need to
Let me
do.
get back to you on that one. And I also feel that that's why, like Rob also reiterated the fact that how important it is that we keep pushing those prevention messages. I'm really thrilled that we're having that big box truck come, because it's all about prevention on that truck. And we can't stress enough, we do have to be diligent. We can't let our guards down. And I know we sound like broken records every week, but really, This is not going away anytime soon, and we just cannot let our guard down. We have to remember washing our hands, wearing a face covering, social distancing, as hard as it is for all of us.
What ability do we have to make face masks mandatory?
I don't believe that's,
Yes. I don't,
You would need to have an emergency order that required that.
and then it comes down to enforcement, Commissioner
Yeah.
Hurd. So,
And obviously, we're not doing a very good job of enforcing the regulations that we have in place right now, because social distancing is not working, in my estimation. I see too many cases of massing where there shouldn't be any. You know, if you have a restaurant that has a full parking lot, it's not at 25% capacity. If you have a party boat that has 20 people on it and it's 20 feet long, you're not practicing social distancing. So can you say that we can't make
I didn't
face
say
mask
can't.
mandatory?
I said you may, you would pass under the governor's order, you can be stricter than the governor, and so you could make it mandatory. I can let you know that earlier this week, the city of Stewart passed a resolution, I believe, that encouraged its citizens to wear face masks. I understand, I know the Village of Indiantown has a mandatory provision, but again, it's very difficult. I would never presume to speak for the sheriff, but it's a difficult thing to enforce.
Well, we have to do something in order to make sure that more people are wearing face masks
Yes,
in
ma'am,
public.
I mean,
well, there's also been, some legal challenges, if you will, as far as government trying to impose those types of regulations on individuals. And so I think there's a fine line that you have to be aware of as you go forward. I mean, you can educate and you can stress and you can, hope that people would do the right thing. But at the same time, I think, if you're trying to, the sheriff in his role would be, I think you'd be putting him in a very, very uncomfortable situation to try and make it mandatory and enforce, because there's some challenges with that and what our residents would be comfortable with. I think.
Well, do you think our residents are comfortable with these?
Well, Commissioner Hurd, every individual has a different level of tolerance in this situation. I think, what Carol Ann was alluding to as far as being able to have the resources available. Emergency management put the request in for the additional nurses. We were fortunate enough to get nurses that were coming from areas that are not as impacted, that had volunteered to come here to be part of that team. So whether or not those individuals will be available to us to continue this rigorous testing. And as we communicated, these numbers are going to continue to increase as our testing increases. But going back to the residents, I think we're happy to try and get the word out. We're happy to see if we can make additional resources available. But it's going to come down to a decision of the board, obviously, if we do an emergency order, but then working with our sheriff, and he only has so many deputies as well. So, we can't be at the beach holding monitoring that situation only for residents, and then we can't be throughout the whole county trying to enforce additional regulations. I think we only have so many resources here, so I think we can educate. Absolutely, we can educate and we can get the word out, but enforcement is always going to be a concern.
Well, these statistics tell me that since we've started opening up, we're having higher infection rates, much higher infection rates. So whatever we can do in order to stem this tide, we need to do it. Thanks.
Commissioner Smith.
Thank you, Mr. Chair. So, Carolina, just so maybe everybody understands, and maybe so we all can understand better, the amount of testing that was going on in the early days, the starting days, and then it was like a 2-week turnaround time to get results back. Now you're getting them back in 24 hours or something like that?
Yeah, and, well, we're getting them back usually within anywhere from 3 to 5 days.
Okay.
Yeah.
So we're trying to come up with the right question or the right number. So the amount of testing we did in the first month, do you know how many tests we did in the first month, roughly?
I probably would have to get back with you on that.
And the reason I ask that, because
It was a lot, it was smaller, and remember, very targeted population and guidelines there.
so I guess that's to my point. There was a much smaller percentage of testing going on, and the results were coming back at 7% or between 7 and 10%. At least that's what I was looking through your numbers at. But now you've like tripled or quadrupled the amount of testing that you're doing. And so it's safe to assume that the numbers look worse than if you had compared them back into March even.
Well, my feeling is that, the more we test, the positivity rate should be lower because of the massive amount of tests that we're doing. So, of course, we're going to see it go up.
But the
this will give us
percentage
a
that's been
good,
tested is significantly more.
yeah, and this will give us a better perspective of really what's happening here in the county. And I think the key is too, all those that are asymptomatic.
I mean, I guess if you look back into the mid-April time and mid or late March, you had a high of 18 cases, 16 cases on a day, right?
Yeah, and if you may recall, back then, there was a holdup in getting those test results
Right.
back,
So
right?
that's- so that was
And so then we
stacking.
saw that spike.
And now, on 5/12, to your chart, we have 12 or 13 cases, but you've quadrupled the amount of testing. So I don't share the opinion that the cases are going up per se. I
Right.
think you're just getting a much more reflective percentage of what's being tested and how many positives there are out of that testing.
Yes, I agree with you.
Thanks.
Okay, anybody else? Okay, I have some too. Go ahead. Go ahead.
Ms. Vitani, thank you very much. It's interesting when I hear both of my colleagues. I think that's almost indicative of how this society is acting. Sadly, I would say that I think a couple of situations are starting to take hold. There is the mask versus no mask crowd. I had been out and about at several larger retail stores with a mask because, for my children's sake and to set a proper example, it's hard for us to say we're educating the public if I'm not wearing a mask myself. So with that in mind, I think there were occasions and obviously anecdotal results, and I won't mention the stores, but big box stores. In the evening, went with my daughter to visit one, and if they were using percentages, I would say that 70% of the people had masks on. A couple days ago during the day, I'm at another large big box store. My daughter and I are wearing masks, and if I would say maybe 30% of the people were wearing masks. Way more did not have masks on. So I think, if you follow on social media, there's people like, I'm not wearing a mask, and people like saying, shame on you, you have to wear masks, and we're getting into civil rights and all these other things, which is disappointing. Okay, but I also believe, and I made this term up, it's about precautions fatigue. When Commissioner Hurd mentions that, she thinks that people are starting to become lax, I think that's human nature. I think people were in the beginning very frightened. Speak to my own experiences. There have been situations in the United States and globally, but let's talk about just the United States, that are absolutely historic. Closed down every school, basically every school district in the United States of America. Someone was on television this weekend saying that's the first time in American history that's ever happened. Closed down the NBA, Major League Baseball, everything. Shut concerts, shut Broadway. Many of you know my son goes to the Naval Academy. They closed the Naval Academy for the first time in 175 years, okay? And so I think that really scared people, that everything, was so big and that everyone went into the procedures and were quarantining. And then we're hearing tragically what was happening in New York and Louisiana and elsewhere, and I think everyone was panicked. But now, if you think about it, 2 months in, as Mr. Lord said, 2 months in from the first day that they started the drive-through, and that was pretty quick, but let's push that out another week. So we're well into like 9 weeks of this. And for the American population and society to stick with it has been pretty good. I still believe, and I had mentioned it a couple of meetings ago, that face covering for employees in any food service business, whether you're in a supermarket or in a restaurant or in a donut store, I think that there's always been a series of health measures that employees had to take. I used to run an ice cream store. We were all foods handling certified, gloves and hair nets, and I used the example a couple of weeks ago about if you've been to certain delicatessens or the cold cuts portion of a supermarket, people that are cue ball bald are still wearing hair nets because that's the procedures. So I think a logical step would be for us to require folks that are in the food services business to be wearing masks. Now, I would tell you a lot of them are, but I've been to a lot of places where some of the employees are and some of the employees aren't. I've received emails, I assume my colleagues have as well. I see on social media a lot of arguing back and forth on, I went to this local restaurant and the people weren't wearing masks, and other people said, well, they shouldn't have to wear masks. If you don't like it, go somewhere else. That I could understand. Personally, I'm not prepared to switch over to the everyone should wear masks for a multitude of reasons. I think, as Ms. Krista said, that's a lot of responsibility to put on our legal and law enforcement departments. Not that I'm saying that if we demanded that they do it, they wouldn't rise to the occasion and do it. I've seen some people criticize the sheriff saying, well, if it's a rule, he's supposed to enforce it. We're not talking about that, but you don't want him to give us a weird sense that, yes, I can do anything. Everything you throw my way, I can do. Just the efforts that are required to keep the beaches to Martin County residents only, I think, has been a lot more than any of us would have imagined. And it's easy for the 5 of us or some of us up here to sit and say, well, it should be this, this, and this. It's totally different when you drive up Ocean Boulevard and you see sheriff's deputies, standing outside their cruiser cars at an opening of a small beach parking lot all day long in the sun, turning away people that have just driven with their families 2 hours and try to engage them politely to say, sorry, turn around and go home. That's a lot. So I take that into consideration. I don't pretend that we're past this, but I agree with what Commissioner Smith said. The more testing, and I've heard this from all of my friends and that are in the health business, the more testing you do, the more results you're going to have. One of my frustrations early on when we were having the phone calls, the unified command call, was how many tests were being done every day. And that's when it was the triage hotline. They were getting 400, 500, 600 people called the triage hotline. That's when people were really concerned, like, I could have it. And then they were testing about 40, 50, 60 each day of that number. Now, a lot of that was because the system was so brand new and the supplies were so limited and the testing facilities were so overwhelmed. Because remember, this is not a Martin County of Florida, it's a nationwide issue. So every lab was being overwhelmed. I think we've gotten into a groove now. We sort of reached our stride on the materials are there for testing. The manpower, if you will, the personnel is there for testing. The logistics are there for testing. Look at how remarkable it's been that you guys have created all these pop-ups all over the county. And so I think that, yes, like Commissioner Smith said, we're having increases. I follow this every single day. As soon as I get that email, I scroll right to the bottom to see plus what. But considering how many more people, you mentioned it yourself, 400 one day, 200 the next day. And, On the 13th, it was 1 tested positive. Yesterday, it was 6. The day before, on the 12th, it was 13. I think that we're on the right track. I think that the reasonable amount of loosening of the restrictions is appropriate, because if you still clamp it down countywide or statewide, I think we open ourselves up to a whole brand-new series of problems where people won't, reasonable people won't want to participate anymore. They will start to really rebel. So I agree with what Ms. Krista said about that fine line. This whole experience has been a balancing act, a fine line, if you will, of being cautious and prepared, but still allowing, especially when we talk about businesses, allowing people to stay in business. Mr. Lord mentioned how many people have been afraid to go and have other procedures. How many folks, there's so many other parameters that indicators we would have to look at. Child abuse, domestic disputes, neighboral disputes, people suffering from anxiety, which leads to drinking and drugs and sadly attempted or a successful suicide. I mean, there's a lot to this, instead of just saying, well, we've had a lot of cases, we better lock it all down. So I very much appreciate what you guys are doing. I think that the numbers are still there, and I think what we are doing, and obviously it's my personal opinion, what we are doing as a county is the right logical steps of opening based on the circumstances that we're in. The last thing I would say is I specifically wanted to ask Mr. Lord about how many folks are currently in the hospital, because to me, the two numbers that are really the strong indicators are how many people are in the hospital and, sadly, how many people have passed away. The rest of the numbers, there's ways to look at them to your advantage one way, positive or negative. You could look at the numbers. But for us, how many people are in the hospital, so sick that they need to be in the hospital, and how many people have passed away. Thank you, Mr. Chair.
Commissioner Hurd.
Yeah, I'm looking at the statistics on emergency room visits because of COVID-like illness, and the low point was 419, and it's been steadily ticking upward ever since 419, which is not a good sign. And also, yes, there's been more testing, but the positive rates are unacceptable. I'll read them. Since we're starting on May 5th, 11.3%, May 6th, 12.7%, May 7th, 35.5%, May 8th, 1.6%, 7.7%, 5%, 8.9%, 9.2%, 4.4%. Those numbers are just continuing to escalate. So yeah, we're doing more testing, but we're getting the percentages are really high, which tells me that we're not doing enough.
May I make a comment? I think that's why it's so critical we keep pushing those prevention messages. But while Commissioner Campy was speaking, I was thinking, what else can we do? How can we reach these businesses more? Maybe provide them with additional one-on-one type reminder and education. These are the recommendations. These are the CDC guidelines. And as we've said in previous meetings, everyone has a responsibility to help prevent the spread of this virus. So I think we have to really keep pushing those prevention messages. And it is everyone's responsibility to participate in preventing the spread of this. So education to me and testing are the two keys here.
Commissioner Heatherton.
Yeah, I agree with you, and I agree, Commissioner Hurd, that the more I'm out and about, the more complacent people seem to be about wearing their mask, whereas a couple weeks ago, you would go and see quite a few. And then, too, we sit in this room, and I bet you most of us in this room interact or talk about COVID every single day. Now, go out into the regular population, and we're assuming that they are as aware in their perception as we are, and I don't believe that's the case. I don't believe, and perception is reality. So if a person that is not connected in the news is in Publix or another grocery store and they see that a significant amount of people are not wearing masks, then I think that gives them this feeling that, things must be on track. Next time I go in, maybe I won't wear the mask. I think what we can do there is, like you said, just double down on education. Anything that we can do, with the county to continue to push that message, to work with the Business Development Board, to work with their businesses, that's what we have to do. And then, Commissioner Campion mentioned sort of a regulatory fatigue. And I agree that, that is something that we are definitely experiencing. And the same thing, it's perception too. When you go out and you see things starting to open up, you have a feeling, if you're not looking at these, and most people are not looking at these statistics every day. Most people are not watching the news every day. So if you have this perception that things are opening up, boy, things must be getting better. So we just have to encourage, I think, that education. And then on the regulatory fatigue, it makes me think sort of my teenage children when I threaten them with taking things away or enforcing things. I'm going to take this away, I'm going to do this, I'm going to ground you forever. When I start doing that, and they say, geez, okay, now I'm getting to the point where I know that she's not going to do that. So they start backing up and the compliance starts to shrink down. So I think that we really need to enforce very highly the things that we can and educate and educate and educate so that people understand the situation we're in. Because again, I don't think that people are looking at this every day. So, but the box truck and the constant pushing of the message of masks is probably a direction we need to go.
Yes, and we're excited about the radio stations. We're hoping that we can reach numbers of people through the radio stations, and many of our young adults and teens through the radio stations as well. And some of the main, the ones that the kids listen to, the ones that the country station and the pop station and many of the stations. So hopefully that, the box truck, we continue with our audio messages, reaching out to our businesses, working with maybe the chambers, we've been talking about that, the homeowners associations, and of course all of our community partners. We get together, we brainstorm, what else can we do? And I agree, we just have to keep being diligent about those prevention messages and educate.
If I can just tag on that. And also to your point, Commissioner Hetherington, and as well as Commissioner Hurd and the rest of you, we're trying to be very cautious in our approach. We recognize that these pop-up testings have the ability to concentrate a focus on particular areas. And so we're trying to be sensitive. I know Commissioner Jenkins himself has experienced this, where you get individuals who all of a sudden start creating this dynamic that they don't want to deal with those individuals or, work with those individuals or, interact with those individuals. So there has to be a heightened level of sensitivity here as we do these testings and we have these positive results come out, that we somehow don't try to differentiate those individuals in a way that becomes problematic for us as a community. So I just want to throw that out there for what it's worth.
And thank you for doing that, for sure. It's my turn. A little bit of a different subject. Last night, you and I both were on the Village of Indiantown virtual meeting, and you did a wonderful presentation, as you do all the time. At the end of that meeting, I believe you were probably off the call at that point, they started talking about their masks situation. They had ordered 5,000 masks that came in as very poor quality, and they're being replaced. Once again, Councilman Thomas brought up the program the state has that specifically targets rural communities. and that there's, I talked to Michelle a little bit about that before the meeting started. They seem to, I guess the way it's written, it's kind of the health department's task is to acquire these and distribute them. They're asking that we do that. I talked to Michelle. When I talked to Michelle, she said they really haven't formally requested that. So be it. Is that something you can accomplish if we as a county initiate that for them, or just please tell me how to?
Yeah, we certainly, yes, I do remember seeing that as well, but we have not received any, and the thought was that.
But did we ask for any?
Well, it was under our understanding that it would have been distributed just based on the community and the population, but we will follow up with that for
Okay,
sure. We'll put in that request.
I'm sure Michelle will have
Yeah,
something to say.
we'll
about it, so,
put in
yeah.
that request. And I do want to thank the many organizations and volunteers that have provided additional masks to us that we've been able to
Absolutely.
distribute out there.
Yeah.
So I did want to mention that. But yes, Commissioner, we'll follow
All right.
up with that.
Thank you. We really appreciate that. Any other questions? With that, thank you so much
Thank you
for
so
all your
much.
efforts. Yes.
Thank you. Appreciate it.
And now we're up to Michelle Jones, Emergency Management Director.
All right. Oh, okay. There we go. Good morning, Commissioners, and thank you again for the opportunity to share an update on behalf of emergency management and to outline some of the successes of our community partnerships. At the state level, since our last meeting, the governor has authorized barbershops, cosmetology salons, and cosmetology specialty salons that adopt proper social distancing guidelines to reopen. Governor DeSantis has also extended the executive order regarding mortgage foreclosures and evictions until June 2nd, providing relief to residents who might not be able to pay, residential tenants unable to pay. FDOH has provided you with the testing update conducted with the support of numerous community partners, and emergency management has been able to provide logistical support to those efforts, including coordination with the state for the nurses and test kits, and providing support to these initial 633 individuals and requesting additional test kits to support the testing sites through the end of May 23rd. With the ability to look up some of the numbers while you all were talking about tests, just for your awareness, by April 8th, Martin County had received 950 test results. By May 12th, we received 2,696 test results. The tests conducted in these 3 initial testing sites is equivalent to 23% of the test results received by May 12th. Granted, we haven't received the results of those tests yet, but in those 3 days with the expanded criteria, we were able to test equivalent to 23% of what had been tested by May 12th. We did make the difficult decision to cancel today's event due to the system in the tropics, but with hurricane season just around the corner and just 2 weeks away, it's an important reminder for everyone to take the time now to reevaluate their disaster supply kit and make sure that they have extra hand sanitizer and face masks on hand during this hurricane season if there is a need to issue an evacuation order. And we encourage everyone to register for Alert Martin by texting Alert Martin to 888-777 or registering online at martin.fl.us/Alert Martin. And this will give important weather updates and public safety notifications. We expect potential for heavy rain and squally weather conditions this afternoon, according to the National Weather Service in Melbourne, and hazardous marine conditions to continue over the next few days with the potential for dangerous surf this weekend. So it's important for our residents to remember to swim or surf at guarded beaches. And very timely with the weather this weekend and with hurricane season around the corner, Emergency Management has partnered with the Florida Division of Emergency Management and Weather STEM to install new weather stations across the county. The first set of these have been or are in the process of being installed in Jensen, Palm City, and at the Emergency Operations Center and Indiantown, with additional installations occurring next week in Hope Sound, South County, and along Jensen Beach. Residents can look at that weather information at martin.weatherstem.com, and they also have an app that folks can download to see what the weather station closest to them is. And that would provide them with a current live view of the weather outside. It provides the weekly weather forecast and even a daily time-lapse video of the weather in a particular location, and you can see the sunset each day if you so desire. So with the installation of these weather stations, they'll provide more coverage and data points for the National Weather Service and more visibility for our first responders who are trying to get back out on the road when we have those gusty and squally conditions. So locally, the Emergency Operations Center has been activated for over 60 days, and the county has remained under a local state of emergency for 9 weeks. During this time, the Community Information Center has answered over 2,800 calls from the public and remains active and available from Monday through Friday, 8 a.m. to 5 p.m. at 772-287-1652. EM has established the Community Recovery Task Force, which has served over 332,000 meals to our community and supporting resources with our partner agencies such as La Haya, the Martin County School District, Boys and Girls Club of Martin County, House of Hope, Salvation Army, the Kane Center, Treasure Coast Food Bank, Healthy Start, United Way of Martin County, the Banner Lake Hub, Community Foundation, the Children's Services Council of Martin County. 211 has answered 2,300.
And also Elevate Hope.
And Elevate Hope.
Thank you.
Yes. 211 has answered 2,330 calls over the last week, seeking to be connected to a variety of services. And United Way is working on compiling a list of agencies that will be providing summer camp with their capabilities, and the Community Recovery Task Force is looking at how we can support those agencies. Yesterday, Martin County Fire Rescue deployed an engine and 4 firefighters to Collier County. As part of the engine strike team, our firefighters will be working alongside firefighters from Orange County, City of Orlando, Winter Park, and Seminole County to battle a 4,000-acre brush fire that's threatening multiple structures. We wish them well in this endeavor, and they do us proud with this deployment. But it's 2020, and we've looked at pandemics and the potential of hurricane season on the horizon. And as we continue to do what we can to protect our community and plan for any other disaster which might impact us, we ask everyone to make conscious and thoughtful decisions to do the same. We continue to recommend wearing face masks when in public and when unable to socially distance, thoroughly wash hands, and keep distance around other people. During this time, we want to stay together while physically remaining far enough apart that we can not reach out and touch one another. So thank you. Is there anything else that you would like to hear about?
Any questions for Michelle? Okay, other than my request for you to work with Carolyn on the
Yes, sir.
mask situation, if
We
you
will
would,
look into
please.
that. And United Way has donated 213 masks for the testing sites that Department of Health has been able to give out. And Cleveland Clinic has donated 4,500 masks to Department of Health for that
Excellent.
initiative.
Thank you very much.
Thank you.
All right. Okay, we have reached the end of our presentations, so now it's time for public comment. I have one request form that's in the room, Mr. Mike Taylor. Is Mr. Mike Taylor here? Okay. Sir, you have 3 minutes.
Hello?
3 minutes.
3 minutes, thank you very much. My name is Michael Taylor. I go by Solo Yacker on YouTube. Declaration of Independence. We hold these truths to be self-evident that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. The Constitution. We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our prosperity. Do ordain, establish this Constitution of the United States of America. The Fourth Amendment, the right of the people to be secure in their person, houses, papers, and effects against unreasonable search and seizure shall not be violated, and no warrant shall be issued but upon probable cause, supported by oath or affirmation, and particularly describing the place to be searched and the person or things to be seized. Title 18, U.S. Code 242, makes it a crime for a person acting under the color of law to willfully deprive a person of a right or privilege protected by the Constitution or laws of the United States. Punishments varies from fines or imprisonment up to a year or both. If bodily injury results, it is a fine or imprisoned up to 10 years or both. If death is a result, you can be fined, imprisoned for any amount of years or life, or you may be put to death. Warren versus District of Columbia is a District of Columbia court case that held the police do not owe a specific duty to provide police services to citizens based on the public duty doctrine. If they have no obligation to protect us, none of y'all have any obligation to tell us what to do, when to do it, and how to do it. I get this whole pandemic. If you're concerned, stay at home, wear a mask. That's all you can tell us to do. But other than that, leave us alone. You all took an oath up here. Y'all were like, I swear or I affirm that I will uphold and defend the Constitution. You are putting these sheriffs, all these deputies out, and you're putting them in jeopardy. They have to fail at their oath. You know, these guys have seen me for what, the last couple days, right? I've been around because guess what? I believe in the Constitution. I believe in my rights. And any one of you that had said yes to whatever you're doing on the Martin County beaches right now is a failure of your oath and you should be fired, period. I'm sick of it. People just want to go back to halfway normal, and this one right here, this lady in the, I don't know her name.
Sir, you can't do that.
Yeah.
It has to be directed to all of us.
All right.
Your time's up. Thank you.
Yeah. Honor your oath. That's
Thank
all
you.
I could ask for you guys.
Thank you, sir.
Honor it.
Mr. Stokas, you're up.
Mr. Chair, the first public comment is from Cynthia Polizek. She writes, I'm a local Hobe Sound resident that enjoys walking and biking to our beach. Please consider allowing walkers and cyclists access to the beach. Thank you. Next comment is from Kimberly Manzer. We need to continue moving forward. Using a face mask should be a personal choice. It's a proven fact that wearing masks results in more hand-to-face contact. All these restrictions you are imposing infringe on our civil liberties. Next comment, Christina Scamoro. I do not think you should be deciding who and who doesn't wear a mask. We are trying to get back to normal, and the governor and his task force, which cost the public taxpayers a lot of money, did not say we had to wear a mask. I believe most people can decide themselves. Of course, depending on where they are, can decide for themselves. Sounds like the news is saying you actually want to ask us to wear them when we step out the door of our homes. I do not believe you have the power to do that. I sure hope not. Can you please just go along with Governor DeSantis and his task force? Please don't be condo commandos. Next comment is from Mr. Sam Harris. I'm asking the commissioners to please vote not to make it a suggestion to wear masks in public. Thank you. Next comment is from Rashad Ali. He's from Boynton Beach. I am a Marine Corps wartime disabled vet, and you turned me away from using the beach. The next one is from Michael Fredericks. Palm Beach County opening beaches May 18th, so no more excuse. Open Hobe Sound Beach on May 18th. More beaches open equals more people spread out. It's time to stop the control of every aspect of our lives. Next comment, Scott Loomis. Thank you to all commissioners and staff for their work in the crisis. My concern is reopening of our library system, and when you think that may happen, thanks, Scott Loomis. Next comment, Brad Barr. Please get softbox leagues back to playing ASAP. By nature, there is almost zero time spent within 6 feet. Using a mat for balls and strikes eliminates the need for an umpire to knee close as well. Next comment is Craig Brockman. Please allow team sports such as softball. It's a sport where there is never people grouped more than 10, and create a caveat of how many people should be in a dugout. But come on. Next one is from Joe, no last name. I would like the commissioners to consider rental mortgage assistance similar to St. Lucie County is offering their residents. Next comment, Bob Dittmars. I want to thank commissioners, staff, and county public servants for their dedication and caring during these difficult times. Being in the older, higher risk segment of the population makes many of us realize how much we all need to appreciate the way you have been managing and communicating with residents. You all and our healthcare providers are truly heroes and should be recognized as such. With heartfelt thanks, Bob. Next comment is from Deb Werner. I would like to request for the Martin County DMVs to open to Martin County residents. I have used their website to renew my tags with no issues. My daughter has turned 16 years old during the month of April. She had to wait until the beginning of May to take her driving test through Treasure Coast Driving School, and she passed. Unfortunately, she is not able to get her driver's license because the Martin County DMV is not open for this service. I tried to go to St. Lucie County, and they would not help me because I was not a resident. Looking at the COVID-19 data as of 5/14/20, Martin County has 275 cases, 6 deaths. St. Lucie County has 299 cases, 26 deaths. And Palm Beach County has 4,176 cases at 254 deaths. Our neighboring counties to the north and south have more cases than our county, but they have opened the DMV offices to only their residents. I respectfully ask for you to open the Martin County DMV offices for the residents of Martin County to take care of services we need in our county following CDC guidelines and social distancing. Next comment, Michael Cloverfield. Good morning. After seeing what happened this past weekend with the sheriff's office checking IDs at the beach, traffic backed up from beaches to downtown Jensen Beach. I am asking you to close the beaches and causeways to the public on Memorial Day weekend. I feel this is a huge safety concern as to social distancing will become non-existent over that weekend if they are open. And you can't count on the sheriff's department to patrol if they can't even keep people from camping on the causeway. Next comment is from Tom Pine. As we fight through this period of uncertainty due to the COVID-19 pandemic, many other important issues are being left out of the news coverage. One such item is the continued killing of unarmed African Americans. Ahmaud Arbery, an African American, was shot and killed unarmed while jogging by 2 white men in his neighborhood of Brunswick, Georgia. Breonna Taylor, an African American, was shot and killed while sleeping in her own bed in the apartment by police enforcing a no-knock warrant in Louisville, Kentucky. I am asking the Board of County Commissioners if we could please have a moment of silence for those 2 people who were killed in questionable circumstances, to say the least. Thank you, Tom Pine. Next comment is from Catherine Harris. Please open Hobe Sound Beach and the Wildlife Beach. Palm Beach is opening Monday. There is not a 3-way road there. There is Bridge Road, Beach dead ends, and only few people live there. The parking at Hobe Sound Beach is only a problem because long-distance bicyclists park there, unload bikes and helmets, leave, and don't come back for 6 hours. Put signs up making them park at the building on Bridge Road before the beach instead of having retirees, pregnant women, families with kids walking from there carrying everything because the bikers took up to 10 to 20 spots. That has been bad, unfair problem for years. It needs to be stopped. Hobe Sound is a kind, gentle town that should not be punished. We have a right to our beach like we have always had. A flu bug is a poor excuse to destroying our freedoms. Next comment, Mary Smith. It is so good for people to be out in the sun and fresh air on our beaches, but add Hobe Sound Beach. It's just as easy to check residency there as anywhere else. Palm Beach is opening, so not fair to keep our beaches closed. So some of us cannot get to Stewart or Jensen, so we need Hobe Sound. I know that one small person doesn't matter, but I waited my whole hard-working life to move to Florida for one and beach and chose Hobe Sound specifically for that. Now when everything good and happy that we had in our lives just 2 months ago has been taken away, when orders and rules over every tiny aspect of our lives has become what we face every single day. When previously free citizens are reduced to begging officials for even the smallest things that were normal life just weeks ago, when sadness and depression are daily companions, is it really too much to just go sit in a tiny space on the beach? It's just not right to keep one closed to please Jupiter or whoever. Thank you. And the last comment, or the next comment, excuse me, is Carol Ann Leonard. She writes, "Thank you for considering and implementing procedures to keep residents of Martin County safe. I agree with most of the decisions and encouragement to wear masks. It's good to continue to keep our beaches open to Martin County residents only. Once other beaches south of us are open, we can see how the people adhere to social distancing and no crowds gathering in one place. I just heard that the CDC has finally been able to send out a 9-page document with advice for reopening. Hopefully it will have a complete guide as to what we should do. One concern I have in regards to restaurants, are they now open with inside dining at 25% capacity and recommending outside dining? It's already warm here, especially in the daytime at times. Restaurants have ceiling fans outside in most of their dining areas. I think this would be a way to spread the virus. Some have ceiling fans inside. There are also AC vents all around the ceilings blowing air in various directions. Are AC vents safer than ceiling fans? Are we really safe? Maybe it's not possible, but should we continue to have delivery, pickup, and carry out a little longer? Thankfully, we have more testing, hence more counts, but the count is rising nevertheless. And I will just check the email, and that, Mr. Chair, is all the public comment we have for this period.
Okay. Well, there we are. Do we want to have a discussion about any other things that would be great.
Thank you very much, Mr. Chair. There was one issue that's been coming up quite a bit. I assume when I get these emails that everyone's getting them as well. Some of them are specific to individual commissioners. Some of them just say commission. So, but I know it's a big issue for us in Palm City in particular, but I know there's leagues throughout. I've received many communications, either verbally or through social media or our county's website emails about allowing baseball and softball leagues to begin again. The school year is over. The virtual testing and the finals and those things are done. And so now what I would like to see is an opportunity for leagues to be able to come and utilize the fields that we have in the parks. Reasonably, in the last several weeks, we've opened up tennis courts, pickleball courts, playgrounds, racquetball courts. I guess some of the things like disc golf and trails have remained open. We've opened our beaches to Martin County residents. I think we have taken, like I said earlier, logical steps in the right direction. If you think about it, and then I do have, Mr. Chair, if it's okay, I do have Mark Rogers is here, who has a long history with Martin County North Little League, but knows all about these things, and they have crafted a list of 18 rules and regulations that they would like their teams, coaches, families, and players to follow. I think they're very logical. Softball and baseball in particular, all of us are familiar with how those games are played. You are spaced throughout the field. There are times when a player might be, a runner is on first next to a first baseman, but they have policies in place to address that issue. I think that it's the next logical step for us, especially considering that the school year is over now, to allow young people and older people that are in, I guess, adult leagues as well. This, to me, is our next logical step, and I would make a motion to allow league play for baseball and softball. Thank you. And if Mr. Rogers is here, if anyone is interested in hearing his perspective as someone who's been involved in this for decades. Thank you, sir.
Commissioner Hurd.
Yeah, just educate me as to how the person at bat and a runner interacts with the baseman, because it seems to me it's impossible to social distance.
You have a reply to that?
Can I ask Mark
Sure.
Rogers to come up? I
Yeah, if you could.
pretend to be a...
Harold,
Yes.
sorry.
Oh, I'm sorry.
Is that okay?
Yeah, hold on just a minute.
I just want to caution the board, and George has done a lot of the research into this. The governor hasn't authorized us to go back to league play. You know, there were essential activities. We closed our softball fields, but the way that the governor's order works, and I know you all know that, is everything was closed down. There were certain activities that were allowed to reopen. With the phase one, there have been a certain loosening for certain activities, again, listed. So as far as I can tell, and George can then go back to the White House recommendation, organized sports and league play, we're not at that point yet. I think that's phase two at least, but I'll defer to
Yes,
George.
Mr. Chair, under the Opening Up America, again, guidelines that was put out by the White House and that the governor has referred to under phase one, schools and organized youth activities, they're currently closed. It does say should remain closed. And that's not just any league play, but we've also looked at not daycare, summer camps, extended day. However, in talking with Michelle Jones, we do anticipate the governor in the near future to move us into phase two where this activity is allowed. So at this point, so we're kind of, again, once in those hurry up and wait moments. And so that's kind of what they're recommending.
Kind of makes this mute, doesn't it?
Not necessarily. I'd still like to hear from Mr. Rogers to answer Commissioner Hurd's question. And then also I would alter my motion to something different then.
Mr. Rogers.
Thank you, Commissioner Campy, and thank you for all the commissioners for allowing me to speak. You know, I have been one of those who has been pestering Mr. Campy about trying to open up our ball fields. We've been working behind the scenes since Little League of America announced that they were going to cancel the Little League World Series and all the outside of state events which lead up to the Little League World Series. But Little League announced that once local governments and state governments allowed organized sports again, that they would encourage leagues to pick up and play baseball, softball, whatever. And I just want to make it very clear, I'm not just here, even though I've been on the Little League board, Martin County Little League board for 22 years. I'm not just here for Little League. I'm here for softball. I'm here for adult. I hear the comments about adult softball. I think it'd be wonderful to open up all fields for all organized softball and baseball. So it's not just my league that I'm here to advocate for. But we have been working diligently. We created a task force within our board to start putting together rules, regulations, ideas, and how we would implement baseball in our league if we were allowed to get back on the fields. That's what led to the 18-point rules that I sent to Mr. Campy to kind of take a look at to get a sense of what we were talking about. I've had conversations with Mr. Gladding. I've had conversations with Mr. Abate. I've had conversations with Dave Diaz at the city. I'm not speaking on behalf of David or for Jeff Hughes at the city, but I think everybody's kind of reading from the same script, or at least has the same understanding that when we can get back on the field, we should be prepared to do it quickly. And I suppose that if we can't, if you as a commission can't vote on it today, if you could give us at least some direction of whether we're going down the right path, and at some point, and I believe the governor yesterday actually referenced youth league sports when he talked about opening up the state to Major League Baseball. I think he's trying to encourage teams to come here for spring training. And I don't know if you know about our governor, it's interesting aside, when he was 12 years old, he actually played in the Little League World Series. So I think he's got a soft spot in his heart for this, and I do think he'll address it. He's addressed a lot of things. But long story short is I just, you know, I've gone to Ed, we're ready. We polled our families, our parents. 95% of the families in our league, we have over 600 families in our league. 95% of them said when the light's green, we'd love to come back to baseball. Now, I'm not going to sit here and tell you I think all 95% are coming back. I think once the reality kicks in, especially Commissioner Hurd, I think some of your concerns, certainly legitimate. I think some families will say maybe not yet. That's fine. But I think that we'll have a vast majority of our families. What I hear from my parents, interestingly, including Kelly Glass, who is a parent in our league, who's also a city commissioner, what I hear from our parents is our kids need to get out. They need to go play. They need organized sports. They need to be around their friends and teammates. We can provide that. I think the great thing about baseball and softball, it inherently creates social distancing, right? You guys, most of you probably have played at least some sense of it and know that defensively you are. We have come up with guidelines for dugouts. We've come up with guidelines for our fans. Keep concession stands open, you know, not have the water fountain on. We have gone, I think we've covered almost everything in our rules. I'm sure there are people that will look at our rules and say, maybe add this, alter that. We're certainly open to that. But what I want to be able to do, and it may not be today because we might not get the vote, the green light, but I'd love to be able to get some direction that when we get that, we will open the fields. Dave Gladding told me this morning, they're 2 days away. They get the green light, they're 2 days away from having the fields ready. I've been over to Sailfish Park, same conditions there, Guy Davis. I suspect that I haven't been to Justin Wilson, but fast pitch softball is going to want to come in and play. I haven't talked to them, but I'm sure that they're interested. And of course, you have adult softball leagues in this county. The parks have been kept up. Actually, ironically, when they're not played on, they're in better condition than when they're played on because the grass grows, the rain comes, and they're nice and green and in good condition. So again, I'm not asking you to do something that defies the governor or defies what the White House wants us to do. What I'm asking for, I guess, at this point, kind of pivoting based on the comments being made, that at least we get some direction of where we might go with this issue. And I didn't answer your question. So, I say to you, I can't tell you, we have some of the rules, like we're going to eliminate the catcher at the lower level, so there'll be no catcher. Can't do that at the higher levels where there's actually pitching. We're going to go down to one umpire. We're going to put them, instead of behind the plate, we're going to put them behind the mound. I can't ask a first baseman not to cover first base because the kid's coming down the line. You got to catch the ball. But I can't ask the waiter to throw the food at me at the restaurant either. He's going to have to come and put it down at the table. I'm not saying it's a great analogy, but I mean, is there going to be no contact? I can't promise that. We're not going to do handshakes after the game. We're going to tip hats, those sorts of things. But I think there's going to be those moments when players are within the vicinity of each other. But we will do the best we can to keep social distancing a priority.
Thank you, Mr. Rogers. I will withdraw that motion and make a different motion. But first, before I do, I'd just like to ask Mr. Stokes, your referencing there was at the federal level that there was no organized league play. What about having our fields open for practice?
Mr.
No
Chair.
games, no official games, just get out there, throw the ball. We talked about having, kicking a soccer ball around or having a catch. Can we have people come in?
Right now, we don't have our fields open for organized activity, which would include practices and so forth. But I think knowing the timing of when the governor might come out with this and in addressing the needs of being ready and prepared, I've talked with Mr. Abate and his staff. What if we wanted to move forward and not have to wait till next Friday, what I would recommend is if the board wants to, direct us that when we do get announced for phase 2, that we are allowed to move into those phase 2 recreational type of activities, and that we will follow the guidance set forth by the governor, the White House, and the CDC yesterday put stuff out that, and as well as their the non-affiliated but associated leagues, and we can make that happen in a timely manner, in a safe manner.
Ms. Woods.
I just want to clarify, we closed our fields pursuant to board direction, so we would be able to, if you give us that direction, we would be able to open when it's in accordance with the governor's orders.
I'd make a motion that when the governor's order allows for field sports, softball, baseball, field sports, if that means, I don't want to exclude, let's focus on this time for softball and baseball, that staff be authorized to immediately begin the procedures of opening the fields and notify all of our leagues of our actions. Thank you.
Go.
In accordance with whatever CDC or social
Always
distancing.
following
Yes,
CDC
sir.
guidelines.
Just to
Actually,
make it clear.
if Mr. Rogers would share the guidelines that they've created as folks that do this day in, day out with the other leagues throughout the county. I know they're generous and they all collaborate, so if you could share those guidelines, I thought that they were appropriate. Thank you very much.
Commissioner Smith.
I'll second that with a modification that it's all league play. I don't think you can exclude soccer. I don't think you can exclude lacrosse. I think if we do that, the wrong message gets sent that
I agree
somehow
with that.
we're
That's
picking-
fine.
No, I mean, no offense, but winners, losers.
I have no
just
problem
think
with
if we're going to go there, I think as long as, again, the governor's guidelines, the federal guidelines, and so on.
Agreed.
So instead of baseball, softball, you're making that
League play.
all league play.
Okay, with that, any other comments? All in favor? Or wait a minute. We have a motion by Commissioner Campy, seconded by Commissioner Smith. All in favor? Aye. All opposed? Motion carries unanimously.
Thank you.
Okay, can we talk a little bit about Hope Sound Beach? Do you have any further indications from Palm Beach County of exactly what they're doing, if in fact they are going to open their beaches on Monday?
I just looked online to see if there was anything released yet, and no, I don't know what time they're meeting today.
Commissioner Jenkins, I read May 26th.
There's a meeting today at
Right.
9:30 by the Palm Beach County Board of County Commissioners. I think they've been in session for a bit. My assistant is monitoring their meeting, but so far she hasn't seen anything.
I know there is a huge concern about Memorial Day, and I also know that Dade County, and Commissioner Smith has been in contact with commissioners down to the south, that they have indicated that they would wait until after Memorial Day to open up, and I've not heard anything different.
But that wasn't, I'm sorry.
Go ahead.
That was not inclusive of Palm Beach in that commentary. That was Miami-Dade's discussion at the time that they were going to wait, at least their mindset was waiting until after Memorial Day for Miami-Dade. That does include Broward and
Palm Beach.
And Palm Beach.
Well, I mean, I would also like to position ourselves that when Palm Beach County does open, and depending on what kind of restrictions they put on it, that we are in a position to open Hope Sound Beach. I do know the Refuge Beach, the federal beach on the north end, is in the same predicament, and I've heard, I didn't speak to them directly myself, but are also anxious to open, but have exactly the same and even more constraints than the Hope Sound Beach has. So it's my understanding that once Palm Beach County does open, that they will potentially open simultaneously with us. So, Commissioner, go ahead.
I just as a suggestion, if we don't hear what Palm Beach has done, for example, I'm not telling you what to do, but for example, if Palm Beach County were to open their beaches to Palm Beach County residents or open their beaches in total, the example given on May 18th, if the board wanted to give staff direction, that we would then amend our emergency order to open Hope Sound Beach. On that, we could certainly do that. The emergency orders, are actually signed by our emergency management director and Ms. Krista and me. So, as long as we had clear board direction, whatever it was you wanted to do, you could give us direction, much as you just did with the athletic fields.
Okay.
If it be the will of the board.
And with that,
Otherwise, we can go back to, we have a meeting on Tuesday.
Yeah, it's pretty important that the sheriff assists Stupor Island in enforcement. That would be a necessary thing. Commissioner Smith.
The only caution about that, Sarah, is having watched what happened last weekend, no matter what we say, and no matter how many signboards we put out, and no matter how many news stations covered it, and they did a phenomenal job. They were on the 6 o'clock news that night after our meeting, and throughout the weekend, it didn't matter. People came. And so just be careful what we ask for and what we say, because no matter what we say, people will interpret that as it's open and ready to go. For whatever it's worth, Harold.
I completely agree. I mean, we have to diminish demand to be able to even try to enforce a Martin County-only opening of Hobe Sound Beach, and it's impossible until we get to that point. Maybe we just have to wait till that point.
Well, either that or if they're going to talk about it today. I mean, I cannot imagine Palm Beach isn't going to have the conversation and decide whether or not they're opening on Monday. I'm willing to come back, or I'm willing to, if we hear, I mean, if we finish, I don't know how much longer we're going to go, but, presumably.
Well, we're going to take a break here in a minute. Maybe we ought to do that now. Maybe we'll get some news by the time we get that. You have a motion? Okay.
Based on the direction that we just received from our attorney, similar to what we did with league sports, I think it's appropriate, even though we will potentially be meeting Tuesday as well. It's not like we'd have to wait until Friday. I watched their meeting last week after hours when we voted to go Martin County only. Their meeting, someone had posted it on social media, and I watched the entire thing. I have no idea why. But they made it sound like they were getting very close. I thought it was the 18th was the discussion. Now if things change, I don't know if they're going to feel that things changed in a direction that would not allow them to do that. But to open up for their first weekend back for Memorial Day weekend doesn't make logical sense. It could potentially be a free-for-all. I would make a motion that, based on the decisions that are made in Palm Beach County in regards to opening their county beaches, our staff would be authorized to work with Martin County Sheriff and Jupiter Police to reopen the Hobe Sound Beach.
Okay. That's fine, but I think there also needs to be something added to the fact that we have no idea what kind of restrictions that, other than Palm Beach County only. If they come up with something that you can only run on the beach, you can't walk or sit, then that's something that will still, it doesn't diminish the demand.
I agree with that. That's true.
Yeah.
So it would have to be an opening.
It would have
All right,
to-
so then
Similar to what we.
we're having a meeting Tuesday. Potentially, we'll just wait. I withdraw my motion.
Yeah, I think that's best. I know. I'm
That would be my recommendation. I can tell you both. Ms. Christ and I have been in touch with, I've been in touch with the Palm Beach County Attorney, and at least the preliminary idea was not until Monday the 18th, but I, too, watched a portion of the meeting. It was a 5-4 vote. One never knows until it's final, to be honest. But they were holding off so that they could confirm, as we were, that both the federal and state agencies were okay with a county resident restriction on a temporary basis.
And we do know that Miami-Dade, based on the information that we've received, is asking the governor to please assist them so that they can start at least phase 1, but they're asking for some lesser restrictive measures. And I know my communication with the county administrator in Palm Beach was Miami-Dade, what Miami and Broward do obviously impact them, similarly to how Palm Beach impacts us. So I think waiting till Tuesday, that will give us time to know what they've done, assess it, and then get ourselves ready.
Would it be appropriate for us to write a letter to the governor encouraging him to do that and explaining the impacts of Martin County?
If you'd like, if it's the board.
I'm just throwing it out there.
My only rationale for today in the direction, following their direction, even though Commissioner Jenkins' issue is that if they open it up just so that you can stand around on the beach, it doesn't eliminate that. My only rationale for making the motion today is that we could have allowed our Martin County residents on the beach sooner if they made an action, if they took action today. But I can wait.
So we can,
residents
behind
are
the
struggling.
scenes, be prepared to open, if we're having a meeting Tuesday, Wednesday, with our lifeguards.
Yes, sir.
And the sheriff's department can interact with Jupiter Island PD and figure out how they're going to. Okay,
Yeah, and the
as long as
timing
we're-
is good for us too. I'm sorry, I didn't mean to interrupt, but we just hired the lifeguards that we were down a couple of positions, and then with a couple that we had that were not able to work, they were on light duty, have come back, so we are staffed so that we can start doing that.
Excellent, okay. All right, so we'll push that issue off until Okay, with that, I think it's time for us to take our 10:30 break for closed captioning. See you back here at 11:45. Thank you. Okay, we're back from our break. Before we move on to our next item, do we have any further commissioner comments? Yes? Commissioner Heatherington.
Just because we've been getting so many questions, and myself personally, on DMV and licenses and registrations, could we invite our tax collector, if she's available, to our next special meeting?
Sure,
To share some
absolutely.
information?
Sure, absolutely. I'll give her a call too, because I know we had done some communication with her when Commissioner Campy had asked about kids being able to get their restricted license, and we got an answer. So I'll reach out to her today.
But there were also some folks reached out to me about liens. There are certain activities that cannot be done virtually or online, and those things have been held up. I know that she's been working on making sure her offices are prepared to be open, but maybe not even wait until next Friday. Maybe she can come and give us an update on Tuesday.
On Tuesday? Sure.
Yeah,
Would
I
be
have
my
a,
suggestion.
I have a title that I need to change on one of my vehicles, but yeah, I'd like to know too.
That was all. Thank you.
You have anything? Okay, with that, let's move on to Department 2, Water Savings Clause Application to Lake Okeechobee System Operating Manual. Mr. Mail, Mr. Gordon, and I see Miss Ruth Holmes here. So whoever is leading this charge, please take off.
Thank you, Mr. Chair. Ruth Holmes from the County Attorney's Office. What we are presenting to you in this agenda item is a proposed letter to send up to the Transportation Infrastructure Committee of the House of Representatives. The reason that we're proposing to do this is because this is a timely letter, and it concerns LOSUM and, of course, Martin County, as well as some of the other local governments around and in Martin County are uniquely positioned to have heightened interest in LOSUM because of the discharges from the lake. And so, as we understand it, there have been other stakeholders in the LOSUM process who have suggested some new language to WRDA 2020. And that language is an application of a savings clause that would essentially require or mandate an older lake regulation schedule that is called Water Supply and Environment, and we always call it WSE. What that would mean for the lake is that the lake would hold more water because the bottom elevation would be higher and the top elevation would be higher. So therefore, the lake would have more water. And for Martin County and some of the other local governments, that could mean more discharges and higher volume discharges. And that is the thing that Martin County has definitely been involved in and definitely tried to oppose and try to suggest new ways to look at these discharges and operate the lake so those discharges don't continue to come to the St. Lucie estuary. So because of what's going on with WRDA right now in Congress, a lot of stakeholders have been writing competing letters to the Transportation Infrastructure Committee looking at, okay, this is how we interpret WRDA 2000, this is how we interpret the Savings Clause, and this is how we interpret LOSUM. And with Martin County and some of the other affected local governments, we got together and thought, well, you know, what do we think? What really impacts Martin County? Do we have any absolutes here that we think are unique to the local governments over on this coast, on the other coast, that we could get together and write a letter to the Transportation Infrastructure Committee that we think is the right interpretation of WRDA, SERP, and LOSUM. And we've done that in this letter. And this letter, for the most part, says that the WRDA 2000 Savings Clause does not apply to LOSUM. And it doesn't apply to LOSUM because the Savings Clause in WRDA 2000 was intended for SERP projects. LOSUM, in and of itself, the operation of the lake and how they plan for that is not a SERP project. With that, we also had to recognize, to be honest, you can't have SERP without the lake. I mean, they're intertwined, and we recognize that. And that's where NEPA comes in, and we're in a NEPA process and with LOSUM. And so we also say in this letter that while we recognize the interconnectedness of the lake and SERP, we also recognize that that LOSUM at the end of the day, what that schedule is, should not be inconsistent with the goals and purposes of SERP. We also recognize that water supply is a big deal, and there should be consideration, and strong consideration, and we're not denying that. There should be strong consideration for water supply in LOSUM. However, we believe that that is a state issue, and those are the points that we've made in this letter. And we think that, along with some of the other local governments, the affected local governments, that this is a good legal interpretation of WRDA, of SERP, and of LOSUM, and what the NEPA process is all about and how it all relates. And so we have put it in the agenda item for you to look at, discuss. If you have any questions of me, Jim or John, we're all here to answer any questions that we can. And we've also realized that there's been because so many people have been involved in the drafting of the letter, there's a lot of drafts that have gone around, and we don't know that you actually got the final. So we also asked in the agenda item that we had the flexibility to tweak it here and there, not to change any substance of the letter or the direction of the letter, but just if we need to do some clarifying sentences on terms or formatting, things like that, we're probably going to want to add other local government emblems as if other local governments ultimately decide to sign on to this letter. So with that, Mr. Chair, if you have any questions.
Any questions? Any questions? Okay, not seeing any questions. We are blessed to have Ms. Jackie Thurlow-Lippisch here that would like to also speak to this.
Hi, Jackie Thurlow-Lippisch. It's a pleasure to be here today. And I am here today as myself and as a member of the South Florida Water Management District. Can you hear me? Can you hear me? Okay, I am here as myself and as a member of the South Florida Water Management District. And sometimes with communication, it's tough for it to all line up right, as we know, especially here with COVID-19. I wanted to let you know and the public know, in case you had been busy, that the South Florida Water Management District did hold a Zoom meeting yesterday, and this topic did come up. And the discussion was in favor of supporting the United States Army Corps of Engineers in its decision to have the savings clause separate from LOSUM. I wish you all luck with your decision today, and thank you so much for including me.
Thank you, Jackie. Okay. With that, yes, Commissioner Hurd.
The letter is excellent. It's comprehensive. It's factual. It's a legal argument that I think is powerfully made, and it's absolutely essential for Martin County to defend our interests. And so I commend you. Once again, the A team has outperformed, and I would move that we adopt the letter.
Second it.
All right. Any further discussion? With that, no further discussion. Any public comment? None. We have a motion by Commissioner Hurd, seconded by Commissioner Heatherington. All in favor? Aye. All opposed? Motion carries unanimously.
Thank you.
Okay. With that, we have reached the end of our agenda items. Our upcoming board meeting is next Tuesday, May 19th, and our special meetings are May 22nd, which I will not be here, Commissioner Heatherington. You will be, and May 29th. And with that, we are adjourned.